Hello, my name is Kinai Poma, and today I'll be performing administration of subcutaneous injection. I have my needle here that I'll be using. For subcutaneous injections, you want to use a 25 to 27 gauge and a 3/8 to 5/8 inch needle, but this is what we have in our kit, so this is what I'll be using. This is 1 milliliters. So I wanted to make sure that I didn't get a syringe that was too big for the injection and or too small. So this is what we'll be using. And I have all my other supplies here. This is my heparin vial, my hand sanitizer, my gloves, and my patient, okay? And I already did the dosage calculations. So the dosage calculations was that the prescriber the doctor ordered 1,000 units of heparin subcutaneously, 1 dose. And what we have in our vial and what the pharmacy gives us is 10,000 units per 10 mils. So we need to figure out how many mils we needed to administer. So I did the dosage calc. It's 1,000 times the 10 mils, and that'll be 10,000. 10,000 divided by 10,000 is 1 mil. So we're going to be administering 1 mil of heparin to our patient, okay? So this is the dosage, the dose that we'll be talking about in this video. So now I'm going to go ahead and do my hand sanitizer. I'm going to go to the medication room and confirm the provider's orders. The provider ordered 1,000 units of heparin subcutaneously and 1 dose. So that is what we're going to give to our patient, okay? So I'm going to confirm the correct patient, Ms. Poma. Correct dose is that 1,000 units of heparin, which is equivalent to 1 milliliters of the heparin medication that we have on stock. Right dose, so right drug, right dose. So the right drug is the heparin, the right time, and the right route, okay? And then the right documentation. The route is subcutaneously, and then the time we're going to give it to her to do now, and then we're going to document this all later. I'm going to grab all my supplies, and I'm going to go ahead and head to the patient's room. I'm going to go ahead and do my hand sanitizer, knock on the door. Hello, Ms. Poma. My name is Kitnoy, and I'll be your nurse today. I'm going to go ahead and close the curtain for privacy. Before we get started, can you confirm your full name and date of birth for me? So now I'm going to look at the patient's wristband. The patient just confirmed their full name and date of birth, okay? So those are the 2 patient identifiers that we needed to make sure before we administer anything and or when we're greeting and meeting our patients. So today I'll be administering some heparin for you, okay? And before we do any of that, can you just go ahead and go over any allergies that you have? So can you let me know if you have any allergies to pets, seasonal allergies, medications, or any type of food? No, she said she's not allergic to anything, so we're gonna go ahead and look at the MAR and the EHR as well to confirm that she doesn't have any allergies. So I'm confirming this. Now I'm gonna go ahead and confirm the 6 stripes of medication again. It's the correct patient, correct time, correct dose, correct route, correct drug, and correct documentation. So I made sure that we did all that. So today, the doctor ordered 1,000 units of heparin to be injected subcutaneously, so that can be injected on her upper arm, upper thigh, or her abdomen area. And we want to make sure if there's any bruising in any of those areas, we're going to switch, okay? So that is what we have for you. Do you have any questions so far? No questions. So I went ahead and I confirmed twice already the 6 stripes of patient's medication. Now I'm going to go over the actions, the side effects, and the adverse effects, okay? So Ms. Poma, the action of this medication, of the heparin medication, is the anticoagulant. So it decreases clotting in the blood. So it decreases the blood's ability to start making clots. And this is what we use it for, okay? So you can use it for DVTs. You can use it if you normally have blood clots or if you do have a blood clot. Sometimes they use this before surgery. So those are the many uses of it. The side effects of this is you might bruise easily, and you might have blood in your urine or your stool. So if you see any of that, you can let me know and we can let the provider know. Some of the adverse effects that you might feel is like swelling of the face, of the throat, or if you have swelling of the tongue. Another adverse effect that you might have is if you start getting a really bad rash or you're just so itchy, okay? So especially if you see like swelling of the face, please let me know as well, okay? Does that sound good? All right, do you have any questions for me so far? No? Okay. So now I'm gonna go ahead and get my medication ready. Get my gloves on. Okay, I'm gonna get my alcohol swab, and I'm gonna go ahead and clean the top of the vial. I'm gonna make sure that's dry. Toss all this stuff out into the garbage now. And then, so like I said before, with these injections, with the subcutaneous injections, you can do it in the upper arm, thigh, or your abdomen area. For her, I'll be injecting into the abdomen area, either the left or the right, and we want to make sure that it's the left or the right of the umbilical cord, so we're not too far in the umbilical cord over here, so you don't want to go too close to your belly button area. So you want to go out here, that way you're able to pinch the skin, okay? And then you want to go right below the costa areas, so right, you don't want to be on your ribs trying to inject this. You want to be on the sides right here. And that's where I'll be assessing her. So for example, I'll just use her left side, her left abdomen area right here, okay? So I'm gonna assess her abdomen area while that is drying. I'm gonna go ahead and palpate. Do you have any pain or tenderness here? No, there's no pain or tenderness. There's no lesions. There's no bruising in this site. And I wanna make sure that if we're gonna inject this more, then there's no other sites over here that or if she already got poked so much over here, we wanna rotate those sites. So I'm assessing and palpating. There's no areas of concern right here. So this is an okay area for us to inject, okay? So I'm gonna go ahead and just clean her skin while we're at it. So you're gonna start from the middle and then out 2 inches. Then you wanna toss this in the trash, and then you don't wanna touch the skin again while it's drying at all, unless you're ready to inject, okay? So now I'm gonna get our solution ready, medication. And you want to get your air. This guy's hard to pull. So I have my 1 ml of air. So I'm gonna go ahead and open up my EHR and MAR again. I just wanna confirm that this, she's gonna get 1,000 units of heparin, and that 1,000 units of heparin is equivalent to 1 mils. So I'm gonna verify the 6 charts of medication. This is the right patient, this is the correct drug, and I'm gonna pull 1 mil, okay? Right time, correct dose, 1 mil, and I'm gonna document this, and this is the correct route subcutaneously that we're gonna do on her left lower abdomen area, okay? So now that I have the 1 mil, I'm gonna go ahead and uncap this. I'm gonna put this to the side, move the hand sanitizer. If I touch something else, I would probably just get a new glove and do my hand sanitizer again, okay? So now I'm gonna go ahead and inject into the vial, just like that, on a flat surface. And now what we're gonna do is, we're gonna go ahead and inject the air. 1 mil of air, there you go. Now we're gonna invert. Then we're gonna get our 1 mil of solution here. There you go. Let me check to see if there's any bubbles. There's 1 little bubble, so I'm just gonna tap, 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 tap. I see 1 little bubble, so I'm still tapping. Okay, so now because there was a bubble, we wanna make sure there's no bubbles when we're doing this. So I'm gonna go ahead and pull again, just to ensure. Yep, there you go. Tap, tap, tap. No bubbles. I realized that you have to tap this kind of hard to get those bubbles out. There you go. So I already got it. I'm gonna pull it out. There you go. Now my 1 mil. There are no bubbles. And then I'm gonna go ahead and recap, and I'm gonna put this away because we don't need that anymore. Soup method to recap, if I can get it on. Okay, so I recapped it. Didn't touch it, just recapped it. And I'm gonna close it just like that. Put it to the side. So we already assessed the patient. If we were going to pull this medication away from the patient's bedside, then we want to label it with their name and or their the drug and the dosage. Okay, so for me, I wouldn't put their full name. I'd probably just put like their initials and then the drug and then the dose that we're giving them. So I'm going to go ahead and confirm that the 6 writes of medication again. Okay, Ms. Poma, I just want to go over that we're going to give you this subcutaneous injection right on your left abdomen, okay? And it's 1,000 units of heparin, and we're going to do this now, okay? So I already confirmed it 3 times. I just wanted to make sure she knew. When I inject this, you might feel some slight tingling or burning sensation. So if you're feeling that, please know that it's normal, okay? So I'm going to be using this hand. I'm going to go ahead and take this off and cap the needle. When we inject this, we want to inject it like a dart, 45 to 90 degree angle. And we want to make sure that the needle is half of the skin fold. So when I pinch it, it should be half of the skin fold, okay? So let's say I didn't clean her area. So half of the skin fold would be about there. You know, when I pinch it like that. And it's about half of the skin fold, okay? So if I touched her skin, I would just go ahead and get the alcohol swab and do it again. So let's say I didn't touch it, but I just wanted to show that it was half of the skin fold. So now what we're gonna do is we're gonna go ahead and pinch using our non-dominant hand in that area. So it's gonna be her left abdomen area. We already assessed everything. Now we're gonna inject quickly, just down. There you go, just like that. And then after we do that, we're gonna go ahead and let go. And then we're gonna hold to stabilize. And then we're gonna inject slowly. Using my pointer finger and my thumb to stabilize it, and I'm injecting. There you go. All done injecting. Now I'm gonna just hold it, and I'm gonna pull it out. And then I'm gonna put my needle in the sharps container, and I'm gonna get an alcohol swab and put it right on the area of injection. I don't wanna push or massage it. We're just cleaning the area and making sure that there's no irritation. So now there's no bleeding or anything. We're gonna go ahead and take this swab off, toss it in the trash. And then now I'm gonna go ahead and take off my gloves, throw all my trash away, get my hand sanitizer on. Okay, Ms. Poma, so we are all done with this subcutaneous injection of heparin. Do you have any questions for me? Do you need anything right now? No, the patient doesn't need anything. I'm gonna give them their call light. Here's your call light. Remember, if you feel any of those adverse effects, please let me know. I'm now gonna go ahead and document my procedure and leave the room. Okay, Ms. Poma, I'm gonna go ahead and leave the room and document my procedure outside. So if you need anything, please let me know, okay? So I'm gonna go ahead and document my procedure, and I'm done.